Well, in case you didn't know, November is Diabetes Awareness Month. And of course, the holiday's right around the corner. And doctors, especially this time of year, they want their patients to know what they're eating.
Well, here to discuss what we can do with just that is Dr. Chelsea Gordner, pediatric and adult endocrinologist with Baystate Health. Welcome.
Thank you.
So tell us why we're focusing so much on this month, and especially with the holidays coming up.
Right, so November is Diabetes Awareness Month, and I think it's an important time of the year because a lot of people are gathering together and socializing, and it often happens around food. Thanksgiving is coming, Christmas is coming, and it's important to be aware of the signs and symptoms of diabetes, and for those that already have diabetes, to best manage it during the holidays.
What are some signs that I would have it? Like if I didn't even know? Like, could I sit down at a table and you could spot something on me?
It's not visible from the outside. The signs and symptoms are varied, but mostly excess thirst, excess urination, sometimes blurry vision, rapid weight loss that's unexpected.
And we should talk about there are two different types of diabetes. This month is kind of focusing on both types, as you had mentioned, but type 1 and type 2, tell us the difference.
So type 2 diabetes tends to happen in those who are more sedentary, overweight. Certain ethnic minorities are at risk, like Native Americans, Hispanics, and is more related to lifestyle.
Okay. What about type 1?
Type 1 diabetes is more related to your immune system. So your immune system attacks the cells that make insulin, and your body's no longer able to make insulin.
And a lot of people have this kind of idea that if you have diabetes, you can't have a brownie, or you can't have this, you can't have that, but it's not all focused on that. Kind of talk about that.
I'm so glad you mentioned that. We never restrict any food when someone has diabetes. It really comes down to moderation and being aware of the foods that can raise your blood sugars. Things like soda, juice, desserts. We don't, recommend that you never have them, but moderation.
Yeah,
Of course.
I saw firsthand with my dad even. He was a big regular soda drinker, even just the transition to diet. There are some minor lifestyle changes, but you don't have to sacrifice basically everything, like you're going on some grand scale diet here. Now, speaking of diabetes, what do people misconceive about this? Are there any misconceptions overall?
Oh, goodness. There are certainly misconceptions. I feel like some people feel like it's a stigma when they have diabetes, and they're embarrassed to talk about it, maybe embarrassed to check their blood sugar or take insulin in public, take medications in public. But it really is important for their health. And I think they will find, if they talk to their friends and family, that they really do understand that it's important for their health, and they'll understand why you're doing it.
Which is important coming up on the holidays, as you mentioned. People are going to be around big groups of people, so you want to make sure that you're open about it and stay healthy.
That's right.
Great tips. Thank you so much.